We are live.
Good evening, everyone, and welcome to our session on epilepsy. Epilepsy is the second most common and frequently encountered neurological condition that imposes a heavy burden on individuals, families, and also on healthcare systems. There are more than 12 million people with epilepsy in India. Hence, this year, we at Techfest have decided to work on this cause under the banner of HEAL, an initiative to raise epilepsy awareness and try to take the world one step closer to a better and more inclusive future. We are elated to conduct this session in collaboration with 𝗦 Somnis, Samman Association, Dr. Urvashi Shah, and none other than Fatima Sana Shaikh. So let's begin without any delay. We have Elisenda Polinyà and Francesca D'Errico from 𝗦 Somnis as the first speakers. I thank them both for being here. I welcome them to tell us more about epilepsy and 𝗦 Somnis.
Hello to everyone. Thank you, Yesha. I'm Francesca, and with Elisenda, we are art therapists, and we work in 𝗦 Somnis. 𝗦 Somnis in English is Sea of Dreams, and we work with childhood and with epilepsy. So I will start to talk about epilepsy, a very short presentation, and then Elisenda will talk about some aspect of our organization. Okay, so I will share. Okay. So to begin, just want to put some question. If we say epilepsy, what do you think about epilepsy? Just take a few seconds to think what do you know about epilepsy, what is the first thing that comes to your mind. And then think what do you know about epileptic seizures. Maybe you know some person that have epilepsy, so you know some aspect about epilepsy, or maybe not. Just do yourself the question. Epilepsy is a chronic non-communicable disease of the brain, and is characterized by seizures, and which are brief episodes of involuntary movements that may involve a part of the body or an entire body. Seizures are, we can see like a discharge on the brain of one part of brain, of all the brain. It depends of this fact, the seizure will be different. We know the 15% the cause of epilepsy. So maybe structural, genetic, infection, metabolic, immune, and the other around 50% of case is already unknown. Epilepsy affects around 50 million people all the world. And seizures can be controlled in some cases. Up to 7% of people living with epilepsy could become seizure-free with appropriate use of anti-seizure drugs. How epilepsy is detected? There are some specific tests to detect epilepsy. Electroencephalogram, brain magnetic resonance, and other studies like studies of video electroencephalogram and the study of the dream. Normally, the doctor specialized in the treatment of epilepsy is the neurologist, and there are neurologists specialized in epilepsy. It's called epileptologist. It's also important to attend to the psychological part of epilepsy to understand how the epilepsy and the seizure can affect the physical and psychological health of the person. This field is called neuropsychologist. Now it's a very important part to us to understand what is an epileptic seizure, because there are a lot of kinds of seizures. We think that it's important to know this kind of seizure to learn how have to do before, during, and after a seizure. So a person with epilepsy can have more than one kind of seizure. sometimes it's hard to tell when a person is having it or not. A person having a seizure may seem confused, look like they are staring at something that isn't there. And other seizure can cause a person fall, shake, lose the consciousness. There are two big groups of seizure, generalized and focal seizures. Okay, generalized is, for example, absence. Sometimes can cause rapid blanking over a few seconds, and the tonic-clonic seizure can make a person cry out, lose consciousness, fall to the ground, even a muscle jerks or spasms. Okay, and the other kind, the person will be unable to respond to question or direction for up a few minutes. May change the sensation of the person, such a strong taste or smell. And in other case, the person can have first a focal seizure and then a general seizure. Okay, seizure may last as long as a few minutes, and it's important to use first the common sense. So stay with the person until the seizure ends and he or she is fully awake. After it ends, the people sit on the safe place. And once the people, it's okay to communicate, tell them what happened, because in the most of the case, they don't have memory of the seizure. And explain in very simple terms. Then comfort the person and speak calmly, and check to see if the person wearing a medical bracelet. Okay. And when the people had a tonic-clonic seizure, may is the seizure that is more hard to attend because we have fear, no? But the most important thing is turn the person gently onto one side and clear the area around the person and put something soft and flat under his or her head. This is very important. And then control the time. Remove something that may injure the people, like eyes glasses, or something around the neck that may make it hard to breathe. And time the seizure is very, very important, or call the emergency. Okay. One thing is very, very important. Don't put anything in the person mouth. This can injure teeth or the jaw. A person having a seizure cannot swallow his or her tongue. Okay, so don't hold the person down or try to stop his or her movement. Apart the seizure, we think that there are other topics very important about epilepsy, like learning and cognitive problems. They be a consequence, can be a consequence of epilepsy. And social isolation. Many children suffer social isolation from having a drug-resistant epilepsy, because up 70% of people can control the seizure with drugs, but other 30% no. It's important for us to communicate that epilepsy is a chronic, non-communicable disease. It's not psychiatric disease. It's a neurological disease. Around 50 million people worldwide have epilepsy, make it one of the most common neurological diseases globally. Nearly 80% of people with epilepsy live in low and middle income countries. And like I said before, up to 7% of people living with epilepsy live seizure-free if properly diagnosed and treated. There are 3/4 of people with epilepsy living in low-income countries do not get the treatment they need. In many parts of the world, people with epilepsy and their families suffer from stigma and discrimination. So just this information is to communicate about the other part of the life of people with epilepsy, it may affect with the disease. Now I want to share with you our organization, 𝗦𝗫𝗶𝗵𝗵. Elisenda, if you want to follow the presentation.
I can ask you if you can put the screen a little bit small, because I don't see all of. And if you prefer, I continue with my screen and you share it.
Yeah.
Bueno, good afternoon to everybody. Here is in the morning, and I want to introduce 𝗦𝗫𝗶𝗵𝗵, the Sea of Dreams is our name. And we have a small surname, like a surname that means childhood, epilepsy, and social transformation, because there are three words that we believe a lot in these three words, and is our mission. We want to explain something about we are, no? It's not important the order of these three images that you are seeing in this moment, because the most important is the third one, is the families who have children with epilepsy. These families together are 𝗦𝗫𝗶𝗵𝗵. We make some activities for them and with them, and at the same time we have a team of volunteers, a very special team of volunteers who participate and give support to the activities. And Francesca and me are in the team, in a staff, to organize the activities and some campaigns to get for improve the life of the families and the children. We are a small network with the hospitals, because in epilepsy it's very important to get good relation with the medical services, and at the same time with the social services to get support and organize some activities and events for give information and training to the families and the other professionals. At the same time, we want to improve, to give some tools to the families for the acceptance of epilepsy, because when they have the diagnostic of epilepsy, it's normal that they feel some fear, because it's an illness that have a little bit of stigma that I want that after we can discuss about that. And normally the families get a little under protection of the kids. And we tried that at the same time with projects and activities, summer camps and some different workshops, that the kids and the young people with epilepsy get responsive of their own health, because they have to learn that they take care of their health, because they need to do it, and they have to learn to do it, and to decide how introduce the epilepsy in their life. And then what we do a space for the families, because we think that it's very important that the families get together and interchange some ideas and some feelings about the situation. Meeting space for the children, because it's very important to have friends, to have fun, and to make activities to grow and to understand how they feel. And awareness campaigns that we want to invite you to think, like Francesca said before, to think about what do you know about epilepsy, but at the same time we want to invite you to put your face for the epilepsy. Is an example of a campaign that we started 2 years ago, and we are trying to animate to the people to put the face, because for us we always say that epilepsy is an invisible illness, because there are a lot of people who have feared to say that have epilepsy, because the society don't understand this kind of illness. It's different if you broke a leg. Everybody see that you have a difficulty to walk, but epilepsy is difficult to understand the needs that the people have, and we want to make more visible this illness and this case. And we want to give you a present with our video of summer camps that probably the organization give you, because you can see in another moment, and you understand better which kind of work we make with the kids. I think that we don't have more time to introduce, but there are a lot of things. We invite you to visit our website. Sorry, because it's only in Espanol, it's not in English yet. But if you have some questions, we can answer you, and we contact after the presentation. Thank you very much for invite us, Mar de Somnis, to this presentation and this program that it's really interesting, and thank you for the opportunity.
Thank you.
Thank you for the informative presentation, Francesca and Elisenda. Next up, we have Carol D'Souza from Samman Association to help us understand the terrific work that has been carried out under the association and her journey with that.
Thanks, 𝗙CE. I'm very happy to be here, and I'm very thankful to IIT Techfest for showcasing epilepsy this year. Samman Association is the Mumbai chapter of the Indian Epilepsy Association, which was founded in 1972. And we changed our name to Samman in 2012. And because Samman was the name of our epilepsy support group, which has been functional and very vibrant right from 1991. Samman in our language, Hindi, means respect or self-respect. We are one of our activities which have continued through the years is the support group meetings, and pre-COVID we used to have them once a month. Now with during COVID, it's not only for our Mumbai people, but all India people join in for these meetings, which are now held once a week. We also have counseling for our members and their families. As we know, there is much more than epilepsy is much more than just seizures. And a lot of these things can be overcome when there is appropriate counseling and appropriate support from family members and others. One of our activities, our major activities, is having rural epilepsy clinics, which we have in 2 village areas, one in Penn and the other in 𝗙𝗺𝗺. And we have them once every 3 months in each area. The one in Penn started in 2007. And we've had it for a long time, and only recently we've stopped having it there this year. And we are continuing at 𝗙𝗺𝗺 in a big way. We need to change attitudes. We need to inform people about epilepsy, what it is, because a lot of people, I find mostly they don't know what it is, and so it's just the misinformation that they have through the years that are stuck in their minds. So we believe that when we go to the school children and talk to them, it is easier to change their minds. And another important area is even at colleges, and for nurses, we have training programs. We also participate in exhibition cum sales. A lot of our members, some of our members who cannot compete in the job market, become contributing members to society by making products at home, and we help them sell their products at various exhibitions cum sales, which are especially held for NGOs. We've had through the years different programs. This was on dance and movement. For our members thoroughly enjoyed this. We've also had workshops on sleep, exercises. So anything that improves the personality development and helps the person live a better life. Our vision is to live in a world where no person is marginalized by his epilepsy, and to help the person exploit his potential to the fullest, to become a well-functioning member in society. Marriage, a lot of people with epilepsy wanted to have such a program. So we had this hugely successful epilepsy and marriage counseling program. We also have a huge presence online with our website, Instagram, Facebook, and of course we have WhatsApp groups. Thank you.
Thank you, Carol. The first step to sensitization. It was great to see how much of work Samman Association has done in that field. Moving forward, we have Dr. Urvashi Shah, neuropsychologist, Comprehensive Epilepsy Care Program, Department of Neurology, KM Hospital, Mumbai, to host the discussion with our speakers and the two NGOs to understand the cultural analogies of epilepsy in different parts of the world and in young age groups.
Yeah, thank you, Aisha, for that kind introduction. And I think, first of all, good evening to everybody. I think it's really amazing that we are having this program about awareness about epilepsy. I'm also part of Samman. And you just heard two NGOs, one in Spain and one in India here. And we heard about the kind of work that they're doing. But I think what strikes us immediately is that why is it that a condition like epilepsy requires this extra support? Why is it that we need NGOs working for the cause of epilepsy? When we've just said that epilepsy is a common neurological disorder, it's a brain disorder, and 1% of the population has it, almost over 2 lakh of people have it in the city of Mumbai alone. So why do they need that extra support when anyone at any time in their life can get this condition? So I think that is important to understand that unfortunately over the ages, there's been so much stigma and misconceptions about epilepsy that people not only have to have that diagnosis and the condition, but then they have to struggle to be accepted back into society. And I think that's the fabulous work that NGOs do. And before this program also, we were just chatting as a group, and we felt really all of us were saying that there are 4 kinds of people, and I like both of them to elaborate a little more on that there are 4 stakeholders when we talk about epilepsy. One is the person himself or herself who receives that diagnosis. And after that diagnosis, suddenly your life changes. It's not only the symptoms, but how society is beginning to treat you. Then, of course, it is the doctor who's communicating that diagnosis and what are they doing and telling the person. Then there is the family and what kind of emotions they go through and what do they do to support the person. And last but not the least is all of us. And what is our attitude towards it? And why do we have to put a person who just has a simple neurological disorder into the shadows? Why does that happen? So I'll ask Carol to start this conversation about these 4 stakeholders, what has been the experience here, and then I'll ask our colleagues from Spain to share what they felt about these issues. So Carol, over to you quickly, and then we'll have our friends chat with us also.
Yeah. Growing up, I was brought up to believe in the stigma of epilepsy. And I am enormously grateful to IIT, as especially the student who, with a background of epilepsy, decided to promote this at the Techfest. I mean, this is really coming out of the shadows. This is saying that, you know, in spite of epilepsy, we can achieve. And there are many of us who are super achievers. As you know, we are doing research currently on epilepsy unemployment. And I just wanted to share, we've just got some 86 responses so far. And after 81, I did a short analysis, and we found 36% had done post-graduation, 1% did doctorate, and 26% were graduates. I was really happy to see these results because it proves that people with epilepsy are achievers, and they really they do face discrimination in certain areas, and this is what we want to fight for. Maybe that is because people equate epilepsy with underachieving or things like that. Yes, there is a population of amongst people with epilepsy who also have problems, and mostly it is when they have epilepsy plus other disorders. Yeah, that's what I wanted to say, Urvashi.
So I think being achievers, I think Francesca in her presentation did mention that over 70% of the people with epilepsy do very well, minimally treatable. Yes, there is a 1/3 small population who need extra support. And I think in Spain, it's a combination of both. I think it's children who have those special needs, but we're also trying to keep rate of for the large 70%, they can do extremely well and they are absolute super achievers and they don't have to suffer this kind of stigma. So what do you have to say, Ellie and Francisco, about this experience?
Well, in Spain, I am sure that it's really similar to India because the people like Carol showed us in the presentation, the kids have different special needs basically in the school, because sometimes get some problems with the memory, the short memory to work. And that makes that they have more problems to study, for example, to memory the things. And this thing makes that they don't have a good quality. Well, do you understand, no? The level. And sometimes, and really sadly, is that they have bullying about the other. And this is a very important thing that we have to avoid, because we work for the diversity and for the respect, like your name, Samman, respect not only for they self, it's for everybody, because the rhythm of the learn in a kid, it's different, always is different. And the people who, the kids with epilepsy have difficulties to sleep. Sometimes the seizures are during the night, and they have problems to sleep very well. And every of you know that if in a night you don't sleep very well, the day after you feel very bad. And they have to live with that. And at the same time, there are something really important, that it's the drugs, the drugs that they have to take have a secondary effects in them. And it's very hard to make all the things that you have to do during a day with these effects in your body and in your mind, because you are really tired and you are a little bit, I don't know how I say, but excited or something a little bit sleepy. And this is very difficult to understand for the rest of the society. And we have to explain better that these kind of things that are invisible to the eyes, and we animate to the children to explain to the others how they feel, no? And the NGOs, that I agree with you, that have this important paper to connect the needs of the people with the sensibility of the society, no? But in these 4 moments that you say before, really good 4 moments, we have to connect that, no, and improve the situation for the people.
So I was struck by what you said about bullying. You know, it's heart-wrenching. And I work 20 years with epilepsy, and every time when the kids come in and they talk to you about, they don't understand why they're being bullied like this in school and being isolated just because they had one seizure and someone saw it and they're made fun of. And as you said very rightly, that sometimes, yes, they have challenges, but it's the medications at times. The medication is making them sleepy. The medication is not making them remember well. They're struggling. They're struggling not only having the seizure, but also with these added things. And then you have a world out there who is not accepting you. So I think it's something that society and young people, I'm sure a lot of young people are listening into this. And all the young people in life have experienced sometimes a little bit of bullying here and there and being marginalized, and they know how it feels, even when you don't have a condition. But for the children here, it's a huge thing. So how do we really sensitize society? I know all this wonderful work that both the organizations are doing, but any thoughts? Carol, would you like to share something, what you found useful, like in all these years you worked with Samman, that what has really brings about change in people in accepting epilepsy? Would you like to comment, Carol? Carol, are you there?
Yeah, other people or the self? You're talking about change in whom?
About the self, it's about other people. What have you found to be the most powerful thing that has brought about a change for a person with epilepsy? In your experience with Samman?
I think our support group meetings, I think our support group meetings have brought about a wonderful change in people. Beginning with me, I told you I was brought up, and there after I joined the association, in no time I was talking about epilepsy all over, not only at the association, but all over the world. So I think the support group meetings and just being with others, seeing them, helping them, it helps yourself.
Yeah.
So I think the change has to come first from us itself. And as more and more people come out and say, yes, I have epilepsy, so what? And people can see that you're well functioning, you will automatically bring about a change in others.
Yeah.
So I feel.
Yeah, Francesca is trying to tell us something, what her experience has been.
Yeah, I think that connecting with what Carol said, there are 2 magical words, me too. When someone explains his or her history about epilepsy, the other one can say, okay, me too. I know your story because it's my story also. And this makes the people feels relief, no? Okay, we can talk about this. So, because sometimes when you have a seizure or when you pass by a lot of seizures, for example, you don't have memory of what happens to you. So the other people have to see you from outside and to communicate, and you can communicate to the other people what is the effect of your body or your feelings through.
I think
there are questions from the audience.
Yes, you can start typing in the answers, Carol, because I think it will be difficult to take the questions like this. But Francesca, that was an important, Carol was talking about the groups, and what she found effective was the sharing, people coming together and having that safe space to share and talk to each other and support each other. And what you were saying was for somebody else outside, like society at large. So it's like when someone is having a seizure and they don't have a memory of it when they come out of it, just to see a face in front of you of someone saying, it's okay. And when you said me too, it's like, it's not a big deal. It's okay. We all go through life sometimes when we slip up. And if it slips up and you've done something and something's happened to you, that empathy or that reassurance or that other person being with you in that moment is very, very important for a person with epilepsy. I think that's important for all of us people who are listening in, that's all sometimes you need. You have to go through those symptoms, but you just need that somebody out there who's understanding you. So also we talked about the family, and sometimes the families become overprotective, and naturally so. Because when you see your child have a seizure and you're so scared, I get so many families who will say, what will happen if she or he goes out on the road and has a seizure? Who's going to take care of that child? So they become overprotective, and they don't realize that by being overprotective, then the child loses confidence, is not able to socialize. We were talking about socialization. So I think maybe you can tell us that what happens to children, they're not given opportunities. They grow up into adults without these opportunities because parents become overprotective. So how do we deal with that too? Ellie, would you like to say something, and then Carol?
Yeah, I want to say that in the chat, there are some people asking for some important things. If you let me, I want to answer. They ask for the treatment. What are the treatments for the disorder? And somebody asked for if some causes it gets cured, no? And at the same chat say that epilepsy is treated with anti-epileptic medication. Yes, people who have epilepsy is considered a chronic disease. There are a different kind of epilepsies, but normally the people have to live with epilepsy all their life. There are some unknown causes, and there are others that Francesca explained before that have an origin, no? But if you take the medication, it's not like you have a pill for the headache that at the moment you have a reaction. There are some medication that it's difficult to find the balance for each person, because have to get a level for stop the seizures, and it's no easy way to find this balance about the pills that you need, you know? And we are speaking now about the secondary effects. These kind of pills are really strong for the kids and make that they have this kind of special needs about the memory, about the sometimes it's something about the body. Sometimes make some strange movement or something like that. And I want to say that it's chronic illness, and that the treatment is not exactly have to improve. And when a kid is growing, maybe you have to adapt the doses, it's correct, of this medication, because you have to avoid the seizures, but sometimes it's not possible to avoid. And then you have to put the person in a security position, and stay with this person, and make that the feelings are soft.
So I think from the questions that are coming, it's more about understanding about the treatments. As we said, that there are treatments. I'm just kind of summarizing what you were just saying, Ellie, that medications are available, and as research is improving, better and better medications are coming up with less toxic side effects. So we're getting better in the way we treat epilepsy. In terms of cure, of course, there is now, of course, epilepsy surgery also, which is touted as a kind of a cure for certain small percentage of patients who do have a kind of, in the brain, we are able to see something in the brain and we are able to remove it, which is causing the epilepsy. There are a number of treatments that are happening, but by and large, as we said again and again, that almost 70 to 80% of the people respond well to medication, and they do well. And they do become seizure-free after some time. So I don't know whether to call it cured, but they become seizure-free. And then there is a small percentage who we say they become refractory. That means the seizures continue, and for them, epilepsy surgery and other things happen. But now we have to unfortunately stop the discussion here because we have to go on to the next part of the program. I just want to tell everyone who has lots of questions, our emails can be put up and you can write to us. We are very happy to answer all these questions one-on-one. But we have to move on to the next part of the program and welcome our celebrity guest for today. So I think we'll stop here. Thank you so much. It was just wonderful. I hope we continue to interact with each other. We are across the world, but we can become one and join hands to do this together. So thank you so much, Carol, Ellie, Francesca, for this wonderful discussion and sharing. Thank you.
Thank you.
Well, thank you for the insightful talk, everyone, and also for answering the questions that were put up by the audience. Now for the very anticipated Q&A with none other than Fatima Sana Shaikh, I welcome Dr. Urvashi Shah again to conduct it.
Okay, so it's really my pleasure and it's really a privilege, I would say, to introduce our So you'll have to bear with me, Fatima Sana Shaikh, because I want to do this nice introduction for you. So she's a very young actor. And of course, all of us know her from the movie Dangal, where she essayed the role of the famous wrestler 𝗙𝗃𝗃𝗃 with complete aplomb. I mean, it was just a perfect portrayal of that character. And then came Thugs of Hindustan. And now we're eagerly awaiting her movies Ludo and 𝗬tože𝗶𝗵𝗃𝗃, which is, I think, coming out in the next couple of weeks. So I think most of you may not know that she, in fact, started out as a child artist, and 𝗙𝗃𝗃𝗃, she was in that movie, and she has won several awards. I read about her award of the German Star of India Award at the Bollywood and Beyond Festival in Germany for her role of Zoya in the movie. She was nominated Best Actress for Screen Awards, won the Best Debut Female Award in News 18 Movie Awards, Best Action Actor. This really struck me as amazing, in Jackie Chan Award in China. And she recently directed herself 𝗙𝗃𝗃𝗃𝗃, a music video, and that was released in September. So she wears many hats, is extremely talented, a strong person. From whatever little I read about you, Fatima, may I call you Fatima, please? So a strong person.
Of course. You can also call me Fatty.
And a very sensitive person. So we really welcome you today and extremely pleased. You're our epilepsy warrior today. You're a celebrity who has come forward to the cause of epilepsy. So I'd like to start by telling you that what made you decide to come forward and champion this cause. Of course, we are absolutely pleased and delighted to have you.
No, firstly, I would like to thank you for giving me an opportunity to be a part of this cause. I don't really get a chance to talk about these things and at the right platforms. So thank you so much. Having dealt with epilepsy myself, I think, I know of the struggle and how I've dealt with it personally. It is very difficult. There are a lot of that all of us, not only me, but everyone comes out and you can destigmatize it. Only then you can normalize it. So I think it is very important to talk about it, and that is the only reason why I wanted to be a part of it.
No, so it's really amazing, as you know, that almost, we said 1% of the population, almost over 2 lakh of people in Mumbai alone have epilepsy, and we don't hear about it. Nobody talks about it. We talk about so many other conditions, but not about epilepsy. So we say it's like a closet illness. People hide it, and it's really sad because people want to disclose, and they're so frightened. And I was just thinking that as NGOs and people who have been working with epilepsy for so years, we've really struggled to overcome these obstacles. And one more thing, Fatima, I was reading on the net about you, and I read about your interest in reading Brian Weiss. And so I pulled out a lot of quotes today from Brian Weiss and the books that he's written, Many Lives, Many Masters, and all that. So there's a little quote which he says, more learning can occur when there are many obstacles than when there are none. So we are all struggling with these obstacles of creating the right awareness in society. And he writes that it's more learning can come out of this. So we want to understand from you, what is the positive learning we can take from this, take home, and what is the kind of roadmap all of us as NGOs should plan to bring epilepsy out of the shadows? How do we plan an effective campaign? You are so influential. I saw 2.3 million followers on Instagram, and this generation responds to social media. Would you kind of talk to us about a possible roadmap that we could chalk out, which would be effective?
I think I'm not the correct person to conceptualize an entire, awareness campaign, because I do not come from that field. But personally, the experience that I have had, I feel it is very important for patients, for people who are, are diagnosed with epilepsy, for them to educate people around them. क्योंकि जब तक मुझे epilepsy नहीं था, अगर मेरे सामने किसी को seizure आता, तो I would have freaked out.
Yeah.
My doctors, they explained me, they guided me, gave me step by step. So I think we should take the responsibility of guiding and educating people around us. And personally, what has happened is every time I have, explained the condition, or how it works and what you need to do to prepare and to do when I get a seizure, I've been asked too many questions. And that is the beginning. That is what we want. We want people to ask questions. We want a conversation to start. And so that there is an open dialogue, and so that we can normalize having a seizure. Apart from that, I think the NGOs are already doing everything else. They are making these videos, short videos, self-awareness videos for public, which is very important, because then it accurately tells you what is the condition, how you're supposed to deal with it. I think personally, in the entertainment industry, I feel if we have characters or stories where we have characters who have epilepsy, that sort of normalizes a condition like this. Because अभी क्या है ना, लोगों को पता नहीं है कि डील कैसे करना है, और पता नहीं है अब तक मेरे आसपास कितने सारे लोग हैं जो आसपास, मतलब फैमिली में भी बात नहीं करते कि उनको एपिलेप्सी है. So, I myself struggled with it. For the longest period of time, I did not want to take medication. I was like, मैं medication नहीं लूंगी, I'm not ill, this is like one time thing, it's going to be fine. Why is everybody making a big deal out of it? But, it's okay. It's like diabetes. आप दवाई लो, you regulate yourself, you stay healthy, and you will be able to deal with it. You can live a very healthy. I was diagnosed when I was doing dangal. So I did all of that. I did all of the training when I was diagnosed. So I was on medication. I did not know how to deal with it, because, you're always sort of literally floating when you start those medications, the ones that did not suit me. And because, it's a trial and error of different things. You need to know what your body wants and how you are going to react to a certain kind of a medication. I think I've lost... are you there?
I'm there.
Yes. I thought I have very bad network, so please. I have very bad network. I'm sorry. So I think, I'm also learning. I'm also figuring it out. I'm also understanding that it's not a big deal. So that is my understanding of how to deal with it, and, how to bring awareness.
So I'm listening to you, and the words that are really striking a chord is when you're saying not a big deal, you're saying normalizing. These are the words, these are what I call the punch words, or the main important words that anyone with epilepsy has to start feeling first. Because unless you feel it, it's not a big deal. And it's like any other illness. It's like asthma somebody can get, or diabetes. You take your medication and you deal with it, and you talk about it, that it's, I have this and this is what happens. But and it's wonderful when someone confident like you, who's successful. And I think it's totally amazing that during dangal, because I saw that video of the training you people did during that dangal to do the wrestler role in that 4 months intense training. So to be able to cope with it so amazingly just tells you that it's not a big deal. But unfortunately, I don't know in our society, it's still. So I'm just curious that when you said you talk to people and you tell them, कि yeah, मुझे ये है और ये होता है, how is their response? What are the kind of questions they ask you? So what is their curiosity? Because people don't seem
I have taken the responsibility of creating awareness and educating people around me, because I do not want to feel insecure. If I get an attack, I do not want to feel uncomfortable, because I know people do not know how to deal with it. I know that I will have to teach them. I will have to give them a list of to-do. I'll have to tell them, please go to, YouTube, में ये link है, ये करो, ऐसे करना चाहिए. मैं सब बताती हूँ. In fact, every set that I go to, I tell them before starting a film that I have epilepsy. These are the to-dos and what to do, what not to do. This is my doctor's number. This is emergency. This is my emergency pill. Everything. So of course, like for a layman, it's going to be like, oh God, there's so much of responsibility. But it's it's better than having somebody who does not know what to do with you at all, or who's getting scared and getting traumatized, because it is not something. It is a little you do freak out, and it's okay. I understand, but I'm the questions that people ask is, are you okay? Do you function? But they see that I'm a very functioning human being.
Correct.
I'm doing everything that I can do. I'm working more. I'm working as many hours as other people on set. So there is nothing disabling about it.
Absolutely. So I think a very important point you've made is that we find in our research is that there's something we call perceived stigma. Very often people believe that there is stigma out there, so they don't do it. But actually when they disclose or they talk about it, they find, much to their surprise and happiness, that people are very accepting and supportive and are helpful. It's just that वो जो डर अंदर होता है कि मैं बताऊंगी तो फिर क्या होगा, फिर लोग कैसे मेरे साथ बर्ताव करेंगे, वो डर के मारे they don't talk about it. So I think you raised a wonderful thing by saying that you have to get over that. You have to tell people, this is the help I need, this is what you need to do for me. And then it's quite normal the way people behave. So I just want to ask, I think I've lost you. Are you there still? I can't see you on screen. Are you there? So I think we've lost her for a moment. Fatima, are you there still? So is she there, Yisha? Or Vivek, can you see if she is connected?
There were connection issues, so I think she's not there.
Come back. We have a couple of questions. Oh, you're back.
Sorry, my call had dropped.
Thank you. So, I think I wanted to also talk to you about, we're coming back to again, you talked about your self-empowerment as very important. I think that's a huge message for people with epilepsy we're giving out here. But there is another side also. People muster up the courage. They go out there and they speak. But we don't know for sure how society will react. So educating society again becomes important. And every society truly is judged by how less fortunate people. And you are a youth icon. And, again, I'm going back to Brian Weiss, in his quote, which is a wonderful quote he wrote that hard life is not a punishment, but rather an opportunity. Many people with epilepsy tell us that it's a kind of a punishment we've received. It's a negative feeling that they have and the fear about people in society. What would you like to tell the young people who are listening in now, who are trying to understand epilepsy? What should they be doing? What is that empathy they have to generate? What should they be saying to other people? How should we get a more inclusive, it's utopian, but let's get an inclusive world here. So as a young person, what will you tell the other young people?
I think we are very fortunate to have very bright, understanding, evolved and accepting young people in our country. And all the people, at least the ones that I have interacted with. And, and I'm not saying that only the young people of the industry, but pan-India. They're very smart. I think this is the right time for us to make sure that we create awareness, we reach out to people. Because अगर हम जब ये नए बच्चे, यंग बच्चे जो इतने स्मार्ट, इतने अंडरस्टैंडिंग है, जब ये पढ़ेंगे या देखेंगे और अगर सही तरीके से समझेंगे, I'm sure they are going to accept and understand the situation. Because now there is a lot of understanding of a lot of other issues also, mental disorders, the youngsters are very much evolved, aggressive with our awareness, I think now, because I'm very sure that the youngsters are going to accept it and understand.
Yeah. So I think we're in a good time in this age where the young people at least, are beginning to want to understand and accept. So that's a great message for them today that they've only started this campaign, the IIT, and then you're there. So we have young people who are now motivated about the change. Yeah. What would you like to tell our people with epilepsy, or parents or families who are really living in the shadows sometimes? So what would you like to tell them?
I think you should talk about it. Come out of the closet. And हमें लगता है कि जो बंदा epilepsy से deal कर रहा है, he is the only one suffering. But it's not that. It's the close ones also, because there are a lot of mood swings. There is a lot of I'm so sorry, my dog is just irritating the hell out of me by barking so much. So I think the most important thing is to talk about it for families, for people who are dealing with epilepsy, because until unless there is no conversation, until unless you don't think that it is okay to talk about it, people around you are also not going to think it's okay. तो आपको एक्सेप्ट करना जरूरी है, आपके परिवार को एक्सेप्ट करना जरूरी है, और इट्स ओके, बात करो. अगर किसी को नहीं समझ में आ रहा, कोई बात नहीं, 10 और लोग हैं जो समझ पाएंगे. So it is important to not to hide. It is important to not to be ashamed. Please do not be ashamed, because I have gone through that. I have been ashamed. I did not want to take medication. I was playing with my own health. I was कि नहीं, मुझे नहीं लेना, मैं ठीक हूँ, वो हम लोग अलग ही ईगो में रहते हैं, which is unnecessary. And it is important because it's not only you who's getting affected. Your loved ones, your parents, your friends, they are concerned about you. What if you get a seizure when, and if you're doing this for society because you are scared what they might think, you are the one who's going to cause harm to yourself. So accept it, embrace it, and just, talk about it. It's okay. It's not a big deal.
I love this. I absolutely love this, that it's not a big deal. I can't tell you how wonderful it is for us when we work so many years with epilepsy to hear this. Is exactly the message we want to bring out, and to say that it's not a big deal. It's just one of those conditions. It can be treated easily, and we have to rally around the person when the person is having a seizure. Just help that person in those few minutes, and then they're fine and they're okay, and they're all achievers. Yes, and when they're great achievers like you,
yes, they're achievers. We are
amazing achievers. So I'm again, I'm a big fan of Brian Weiss also. So I loved it when I heard. So I again went back to, I want to end this conversation because almost the time is up. I don't know, I really don't have the words to thank. I just cannot express. So I really mean this, and I think I'm saying this on behalf of all our people who are listening in, that it's truly amazing what you shared with us today, and just the strength and the confidence that you exuded about that it's okay and we can talk about it. So I think we have to start a campaign where we say, let's start a conversation about epilepsy. Let's just start talking.
Yes. Yes.
And we really look forward to you being there with us and starting this conversation.
Yes, I'm always there.
IIT and many other youngsters, as you said, this is a different group. It's a different generation. They will embrace it. They will change, and they will be able to change this situation. So let's join hands, create value, create conversations in this world about epilepsy. And thank you so very much once again for being with us. Thank you.
Thank you so much, ma'am. It's a pleasure to be here and to be speaking to you and to everyone. It's a great cause, and I'm very happy to be a part of this.
Thank you. Thank you. God bless you. Thank you.
Thank you so much. Bye-bye.
Thank you, Fatima and Dr. Urvashi. It really is something to have someone influential speak upon a crucial and sensitive matter from a perspective of first-hand experience. And with that, we conclude the session. I thank all the speakers, our celebrity guests, and the NGOs 𝗦, Somnis, and Samman for being a part of this initiative. We hope the session reaches as many people as possible and maximizes the intended awareness regarding epilepsy. Thank you, everyone.